The hemostasis process is triggered by bleeding as a result of a vascular injury. The body then sets a series of steps in motion that lead to closure of the vascular opening and thus stops bleeding. The first step is the rapid formation of an unstable mass of platelets at the site of the injury. Coagulation reinforces that mass by forming a fibrin network. Coagulation is actually an ordered series of steps, thus called a coagulation cascade, involving coagulation factors. Each factor depends on the previous factor for its action, and each factor is important in the coagulation cascade. Coagulation is initiated by the binding of activated F7 to the tissue factor expressed by the injured tissue. This complex then activates factor 10 into 10A and factor 9 into 9A. Activated factor 10 induces the generation of sufficient traces of thrombin to activate factor 8 and factor 5. Activated factor 8 binds to activated factor 9 to form a propagation complex and thus generate large quantities of factor 10A. Factor 10A, when bound to factor 5A, then amplifies the production of thrombin to trigger the transformation of fibrinogen into a fibrin network. This network reinforces the clot that blocks the vascular lesion. Some people are born with a quantitative or qualitative deficiency in one or several coagulation factors. Their coagulation cascade does not function normally, and their bleeds are thus longer and more severe. Depending on the severity of the deficiency, the patients have diseases with more or less severe consequences. The pathology differs depending on the missing factor. A deficiency in von Willebrand factor causes von Willebrand disease. Hemophilia A is caused by a deficiency in factor 8. Hemophilia B is a deficiency in factor 9. Other rare or very rare deficiencies are also known. These include congenital factor 11, fibrinogen, or factor 7 deficiencies. The treatment of coagulation factor deficiencies aim to replace the missing factors and restore the coagulation cascade. Congenital coagulation factor deficiencies are chronic diseases that require lifelong treatment. The treatment significantly improved the life quality of these patients.